So good morning, everyone. Today marks 272 days since our first case of
300.
COVID. Oh, what did I say, 200? Thank you. You're right. 372 days since our first case, going back, it has been a long 372 days, since March 12th, and 54 weeks. But we're getting through it. We are New York strong. Things had to be reimagined, things had to be differently, and to everyone out there doing the right thing, thank you. I know it's still unsteady for a lot of people, and I've said this. Our stress level is different than other people's stress levels. Being a doctor, stress level is higher. But certain people, it's hard. You got to take a step back, take a deep breath, and realize the world's different, and people handle things differently. So, but I'm happy to say no one passed away, which is good. But to the families that lost loved ones, again, our prayers and condolences go out to you. So, just kind of want to focus on some of the good stuff going on. I mean, and our numbers have been low, which is good, and no one passing away, which is good. Our nursing homes opening up, which is good. Things are starting to open up, but we still need to remember COVID-19's here. We still need to remember to wash our hands, cough into our arms, clean, stay 6 feet apart, and continue to clean our hands, because we'll get through this, and we'll get through this working together. So please, everyone, stay vigilant, stay doing your job, and we'll get there. Some of the things that we don't like to talk about, if you look at the article that's been in the paper and Dr. Fauci, we're seeing a spike in certain areas, and it's alarming, and you're seeing it in Connecticut, New Jersey, New York City, Mid-Hudson Valley, Long Island regions, and we don't want to see that happen here. So we want people to continue to do the right thing, continue to get tested, continue to get vaccinated, continue to wear your mask, and we'll continue to get through this. But if you look at, and Dr. Whalen and I have talked about 1,000 times what's going on overseas. Italy's on lockdown again, Europe's on lockdown again, but things are going good, and we have to stay that positive note, and we have to stay ahead of this, and the best way to stay ahead of this is to continue. Even if you get your vaccine shots, you still got to wear a mask, you still got to distance, not unless you're with other people that both of you have your shots, you don't have to wear your mask. So, but again, if you're out in public, you're at the workplace, you got to continue to follow the protocols. As of today, we had 21,572 cases of COVID-19 in Albany County. 65 positives today. Yesterday was 90, so we started to go up and we're going down. I can't believe I talked to Dr. Whalen and I say this, and we talk, and it's weird that 90 is not a big number anymore, or 100. When we started to get 2, 3, 6, I remember the panic, but like the priorities we put forward to go forward. And, but again, the vaccine's here and things are getting done, and things are getting done differently. So the 5-day average daily positive is 61. Yesterday it was 57, so we went up a little bit there. There are currently 1,353 people under mandatory quarantine. Yesterday it was 1,393. Out of the new cases, 14 had close contact, 2 were healthcare workers, 2 traveled out. And 47 don't have a clear source of infection at this time. 21,118 people have tested positive of the virus and had recovered. That's good. We've always talked about this. I know my buddy Dave on Facebook likes to point out that we don't talk about the positive side of it. There's 21,000 people. But there's lasting effects with a lot of people that had COVID-19, and unfortunately it happens. I'm watching my brother Kevin go through it, and it's a long road to recovery, even though when you're out of the hospital. So out of that, 71 recovered since yesterday, which is good. 5 new hospitalizations overnight. There are now 24 people currently in the hospital. Yesterday the number was 21, so we went up a little bit. There's 5 patients currently in the ICU, and there's 5 patients yesterday. So again, staying in the right direction, keeping our numbers low, and that's what it's about. And I keep telling everyone, we still need to follow the guidelines and to keep the virus under control. And the only way we're going to do that, and it's a broken record season, wear a mask, cough in your arm, wash your hands, and stay 6 feet apart, and we'll get through this. And please go to the state website if you want to see if you're eligible. 1-8 833-697-4829. Things are starting to open up more. We're starting to get there. So I know a lot of people have a lot of questions. Do they qualify? It's open to restaurant workers, frontline workers now, nonprofits like the food banks and all that. We have different guidelines. This last pod, and Dr. Whalen could talk about, was opened up a little bit more to facing employees, which was good. Because we had to concentrate on a certain, factor to break down the variable of the problem that we're in, meaning that, they said we can only do teachers and firefighters and union teachers, right? So that, we had to turn people away. And I know people get mad, and I'm like, no, this is what we get shots. Or they go, here's 500 vaccines, but you have to use it in 65 and older. Can't give it to anyone else. And, so it's, again, just bear with us. We're all getting there. And then, there's, the Washington Armory site that still has available slots. Albany slot is opening up with more appointments necessary. Another state-run mass vaccine site for the Capital Region opened today in Queensbury, the Queensbury Aviation Mall, which is good. So that's another site for people to get to. And I will say to people that I keep getting this question. When I was at Crossgates getting the hats, they're like, "Hey, can I come to Albany County if I live?" Yeah, you can come here. No, Dr. Whalen's not going to look and say, "Hey, you live in Rensselaer County, go over there," or "You live in Schenectady." If you're eligible, you get on the list. So obviously we want to do Albany County residents, but again, we're in this together, and the only way we're going to get through this together is by just getting shots in arms, and it gets us at the end of the tunnel. So I do want to say it's a little bit of a drive for Albany County residents, but another option especially is further north. But United Way 211 hotline for help getting information. That's still been working well. Thank you to Pete Gannon and the staff there that have been handling this. It's been a useful tool. I mean, if you see the hardest aggravation anyone has is the fact that trying to still get online, and to the kids out there that are helping people and the stories I've been seeing on TV and online, that's awesome. Thank you. It just shows you that there's still a need. We have our Albany County website you can go to our COVID page. It gives you all the eligibilities and everything else. The pre-registration's been huge. It takes a lot of anxiety, and that's what we see with a lot of people. I had one lady apologize yesterday to me, and I'm like, listen, it's no big deal. I get it. She was frustrated trying to get the shot. She couldn't get qualified. She couldn't get an appointment. You still have that problems, and we had a little bit of an issue. I think it was yesterday, the day before, the pod with the pre-registration from the state. It wasn't just us. I talked to Marcus from Dutchess County, and they had the same issue with people that were duplicate or something happened with the state system. So we got through it. Dr. Whalen and her team do what they do best. They got everyone on there with my office, and thank you to my office too. And we got the slots taken care of, but it happened. For some reason, but it was a glitch in the state system. To date, we've have over 35,000 people pre-registered, 24,000 Albany County residents, which is great, and we're knocking that list down. So please pre-register, because we're at the point where we're not going to have anyone left on the list if you're eligible. So please, I know there's still people left on the list. If you're not eligible, you will not be contacted when you fall in that category. You get in there. But here's some really great news. 30.4% of Albany County population has received the first dose. 30%. We need to get to 70. It's like I'm watching the stock market, which don't understand, so I'm not going to tell you that I do. But watching this, it's like every day I want to know where are we at, where's our percentage? Because we get to 70, and you're not going to get into 25% capacity. You're not going to get into 50. You're not going to get into this and that. We can start to get out there normally. We still need to get the shots, and you still need to do what's right, but we can get there. So Albany County's population has received at least one dose of the vaccine, and an estimate 15.4% have received both the first and second dose, which is all good news. Overall, we have administered or reallocated a total of 24,325 vaccines. We either administered or we did 17,455 ourselves. The rest we did in partnerships with the center, nurses, Mohawk Ambulance, the Sheriff's Department. These are things that we work together in a partnership to get it out there the most effective and safe and quickest way of taking care of people. Like I said, Albany County alone has done 17,455. This includes 889 first shots at our Times Union Center yesterday, just shy of the 1,200 during our clinic on Wednesday. We also sent 500 doses to UAlbany and Russell Sage for staff to be administered yesterday in a partnership with UAlbany in Russell Sage. And on Saturday, we hosted a pod with Mohawk Ambulance at St. Sophia's Church. It was at the apartments, not the church, so it was a little confusing. 102 doses. Like I said, them smaller pods for some reason do better than the bigger pods. People just like to be in a smaller group, and that worked out well. So that pod was good. A couple hiccups happened. It was a smaller pod, and we got a little bottleneck. But other than that, it was a good pod, and I thank my volunteer. And Pat that volunteered there that day with Mohawk to keep it going, so thank you for everything that you do. Remember, public-facing government and nonprofit employees are now eligible to get the vaccine at state sites as well as ours at the Times Union Clinic. Please, so I'm just giving you a small list of what it means. It's social services, caseworkers, sanitation workers, and others. We've also gotten some questions on this, and so I want to remind everyone, restaurant workers are eligible at our Times Union Center Clinic, and generally along with anyone over the age of 60. So the restaurant workers are eligible. Please come out and get your vaccine. You've been on the front line like everyone else, and and like I said about teachers, you can also get your vaccine at pharmacists. So if they have the supply, just check. And I want to make a quick note that some of the Schedule 2 doses clinics originally scheduled at the Times Union Center. We have a little conflict with the NCAA tournament, which is a good conflict to have. Well, for us, maybe not Dr. Whalen and their team. But it's good. So they're going to be at the Capitol Center on the dates of March 25th, which is a Thursday, March 27th, that's a Saturday, and March 29th, that's a Monday. And they will be there and addressing them issues. So again, I want to just remind everyone too, Governor Cuomo just recently announced the reopening guidance for restaurants. Outside New York City is 75% capacity, which is great news for local businesses who've been struggling through this, that haven't even opened up their doors all winter long. And now we're going to try, because of the nicer weather, to open up with the patios, but to have 75% is awesome. Wedding receptions can resume. As we know, the restriction was at 50% capacity, no more than 150 guests. All guests must also show proof of recent negative COVID tests or proof of vaccine that when it takes effect March 15th, which happened. And there are a number of other restrictions. So to the people hosting weddings and going to go back to banquets, please go to the state guidance, read it. And, there are some restrictions, but that's also good news. We're going into the right direction and things are opening up. Yesterday, the governor announced large and small regional sports venues can reopen April 1st. Based on their arena size and stuff like that, 10%. And then fans outside, 2,500 fans, will be limited to 20% that are outdoor concerts and stuff like that, which is all good news. But for us, we will be lobbying the control room. General Murphy will be getting a phone call today from me. We need to open up to at least 25% for our Times Union Center. We got a 17,000 seat arena. We can socially do this. We did it. We showed them we can do it. It's the only way arena football will be able to open up, because they need the capacity to just break even. So that's important, and it puts people back to work. Stage handlers union, the workers down at the TU, Aramar, all of them end up coming back to work, which is all good, and start to get some type of normalcy. Arenas like ours and the Palace Theater and all the theaters, Proctor's, have been hit hard with no real relief for our Times Union Center. So this is a good thing if we can get it open and commitment to at least 20% capacity by April 1st. So that's what I'll be lobbying for, because our numbers are staying under 2%. We're doing real good here. Help me start to open this up. And concerts are being booked. In order for a concert to be booked, we have to commit. And they're not going to book if it's below 25%, because they just can't. It's not worth the logistics of traveling around the state or around this country and coming here and setting up for 10% capacity. So we're looking for 25 to make this happen by April 1st. So Again, I do want to say to everyone, please continue to do the right thing. One of the things, starting Monday, the limit for residents gathering will be lifted from 10 people to people for indoors to 25 people outdoors, and the limit of social gathering will be lifted from 50 people to 100 people indoors and 200 people outdoors. So, which is also good news. Things are moving in the right direction. I do want to thank the president of Albany and them into really working with us with the college kids coming back. We don't want to have any episodes. We don't want them out there having parties. Please continue to do the right thing. Everybody, and not just Albany, all the colleges, Siena College and Maria and Sage and all the great unions or colleges we have here in the Capital Region. We'll continue to get through this. Dr. Whalen.
Good morning. So certainly in terms of the vaccination, there is a lot of good news that we have been able to get out with our partners over almost 25,000 vaccines, and we remain committed to that mission to get Albany County vaccinated. This is the best strategy forward to get us back to some semblance of normalcy, which all of us have been really looking forward to for the past year. There are many of you that are trying to get vaccines, and we look forward to the expansion of the criteria for vaccination in keeping with the presidential remarks of having every adult over the age of 18 available to be vaccinated by May 1st. And in the meantime, we are working within the guidelines that we have been given by the State Health Department. And, there was an opening this week for forward-facing government employees and for non-for-profits, which brought us additional people in to be vaccinated. This is all good news. I want to really encourage people that when your time comes to be vaccinated, please sign up and be vaccinated. It is the best way to move forward. You are not only helping yourself, you are helping those that you are surrounded by, your loved ones, the people that you work with, the people that you interact with on a daily basis, and you're making those interactions more possible. So everyone has to realize that, getting vaccinated enables you to, be more of what you want to be, and what you were before the pandemic. We all have to understand this. And as I said, I think there was many people that are currently trying to get vaccines. There are some people that are committed never to get vaccines, but there are a lot of you that are in between. And those are the people that I would like to speak to about the importance of having confidence in this vaccine. I have been vaccinated. I received the Moderna vaccine, and I would not vaccinate or encourage family members to be vaccinated unless I believed this was safe, unless I had reviewed the scientific evidence. And I will say without reservation that I do recommend vaccination. I think getting the public-facing government employees is helpful because you see people like the county executive, Mayor Sheehan, Governor Cuomo are all now being vaccinated. And hopefully this will help the public perception that this is a safe vaccine. People think the vaccine can give you COVID. It cannot give you COVID. It is not, you're not being injected with any kind of a disease. It helps you make antibodies so that if you become exposed to the disease, you do not become sick, you do not have to be hospitalized, and you do not have to die. This is incredibly important for all of us. It is also not a vaccine that can interfere with your DNA. I really want to make sure people know that. If you want information on the vaccine, it's really important to know where to get that information. And trusted sources include our health department website, the New York State Department of Health's website, and the CDC. Facebook is not a trusted source of vaccine information. There's two important tenets that I want to stress. When we talk about evidence, when I talk about giving information to the public that is evidence-based, it's important to know that evidence does not equal anecdote. What does that mean? That means that evidence takes the experience of a large, statistically significant group of people and tells you what risk is. Anecdote, in contrast, is a story from someone who gave you their personal experience. There's a big difference. So when we give you statistical evidence, when we give you evidence-based information, it really is based on a very large proportion of individuals. And so there's reassurance in that evidence, in the safety of this vaccine, of these vaccines, the three that we currently have available to us. The second thing is that correlation does not equal causality. So just because something happened that may have been temporarily related to something, it doesn't mean it was a cause of something. And this is another important thing that people have to understand and weigh in when they're really hearing people telling stories. Look to the evidence. Look to the large group scientific studies that give us reassurance on the efficacy of this vaccine. It is reassuring that our numbers of cases are decreasing, but they're not low enough for us to take a pass yet. They're not low enough for people to say, well, the numbers are going down, maybe I don't need to be vaccinated. And why do I say that? Because, as the county executive indicated, we're seeing in other countries a third wave. The term third wave is not something that we want to think about, but it is definitely a possibility. And as we see these highly communicable strains emerging, and we see spread in different parts of the country and in other countries, this is a major concern for us. And there are really only two ways that we can avoid a third wave. The first is to continue the mitigation behaviors, the public health behaviors that we have discussed from day one, which is to mask up, to keep your distance, to avoid large gatherings, and to wash your hands. And the second is to be vaccinated. And again, vaccine at this point is with Pfizer or Moderna. Pfizer has 2 doses 3 weeks apart. Moderna has 2 doses 4 weeks apart. And Johnson & Johnson, which we have availability of this week and are utilizing as directed from the State Health Department for our homebound population, that is a single-dose vaccine. All of these vaccines do not take full effect until 2 weeks after the final dose of the regimen. So again, we do see people get that first dose of vaccine and think they can go out and not wear a mask and act normally and socialize, and then we see them come down with COVID. That's not at all uncommon, unfortunately. So know that it takes your body time to build these antibodies, and that it's not fully effective until 2 weeks after the second vaccine. We're happy to continue to vaccinate residents from New York State. That is the only, criteria for residents that we look at when somebody comes to the clinic. So we can certainly take people from outside Albany County, but currently we are taking residents of New York State. And finally, I just wanted to mention, I know there's been a lot of questions on the schools and reopening of the schools, and in particular the 3-foot guidance. And I understand that the CDC is going to be issuing guidance today that shortens the distance from 6 feet to 3 feet. At this point, we are awaiting review and further guidance from the New York State Department of Health. But we know that we are all committed to doing what we can to get kids back into a school environment. I've talked many times, as has the county executive, about the other tolls that the pandemic has taken. We know mental health, we know education, and we know family lives have been certainly disrupted by the shutdowns. And we do want to take those steps to try to get back to normal. But it is essential at this point that the dual strategies of community mitigation and vaccination are part of that larger picture. And we look forward to working with all of you going forward on that.
Thank you, Dr. Whalen. And I'm glad you brought up the school stuff. I know there's a school board meeting in Albany. We're getting the blame for the not being in person in the school system. Please, parents, it's not us. It's guidance from the CDC. It's from the state health department. As that changes and we put that out, we can change things. I know they're talking about doing a protest on us, coming down here, writing letters. I've been watching it. I didn't bother to get on the Zoom meeting last night because, the school board has an obligation to educate themselves too, to drive that during the meeting, to educate the parents that are coming to that Zoom meeting, to let them know these are the guidance. These are just things that the state Department of Health gives us. Dr. Whalen and her team go through it, and we give the guidance to the City of Albany. Gilderland's in person. There's other schools around the area. Colony's all been in person. Albany chose a different path, and that's fine too. They thought that was the model that they needed for their schools. So I commend them for that. They have to do what they think is best. But that school board, you have an obligation to educate the parents and let them know that this isn't us saying no. And the guidance just came out. When I said it the last time, the 3-foot rule just came out. But again, it's like when the governor gives us an announcement, something's going to open up, and how long do we wait to get guidance? We can't just make it happen overnight. We have to wait to get the guidance, and when they give us the guidance, we put it out. And and again, we'll get to the City of Albany, but I believe every other high school in our county has been open in person, except Albany Public Schools. If I stand corrected, I stand corrected, but I can't think of any other schools, high schools, that have not been in person, other than when they had a COVID-19 outbreak or whatever the reason might have been. They had to go virtual for that week. Some schools often gave both, Boys Academy, Girls Academy, CBA, I think Holy Names offered both. In LaSalle, you could do in person, you could do online, whatever you're comfortable doing. But I do know, I think the Albany school systems are going back fully April 27th, somewhere in that time frame, for the last 35 days of school. So to the parents, please watch this or educate yourself. Don't get caught up in the hype. Take a deep breath, take a step back, educate yourself, parents. It's the guidance. I know it's not what you want to hear. I know how much ground kids have lost. Think of the kids with disabilities, dyslexia, learning behaviors, or whatever their disability may be, how much ground they have lost these last 12 months, more so than anyone else. And I know with the regents and everything like that are coming up in June, now they're on, they're off, I don't know. The president said they're on, the governor says they're off. But it's a lot of stress. Dr. Whalen, we both have 2 daughters that are both the same age, that are faced with the same thing going on to college. It has changed for a lot of people. So please be patient, educate yourself. Mental health's available 7 days a week, 8 a.m. to 5, 518-269-6634. As always, our sexual assault hotline number, and the state and everything else. So again, please stay safe out there, do the right thing.